You wake up, eyes still closed, and the first thing you notice, your mouth is completely dry, lips stuck together, tongue heavy like cloth. You reach for the glass of water on the nightstand, drink it down, and tell yourself what you always tell yourself. I just didn't drink enough water yesterday. You get up, go about your morning, and by midday you've forgotten about it. Until tomorrow, when it happens again. And the day after that. And the week after that. I need you to hear this clearly. Waking up with a dry mouth every single morning is not normal. It is not an inevitable part of getting older. And in adults over 60, it deserves serious attention. Because it can be one of the earliest signals the body sends before conditions that, caught early, are fully treatable, and caught late, cause damage that cannot be undone. Here is the number that should stop you cold. In adults over 65 who take 5 or more daily medications, and that describes nearly half of all older Americans, dry mouth affects more than 60% of them, more than 6 in 10. And the overwhelming majority believe it is simply what aging feels like. It is not aging. It is their body trying to tell them something, and nobody has taught them to listen. In over 20 years of treating patients over 60, I have learned to pay very close attention to the signals the body whispers before it starts shouting. Morning dry mouth is one of those signals, one that can whisper for months, sometimes years, before the underlying problem shows up on a standard blood test. Today, I am going to show you the 6 most important causes of dry mouth in people over 60. From the simplest and most correctable, to the most serious and most overlooked by routine medical care. And more importantly, I am going to tell you exactly what to do with this information, what questions to ask, what tests to request, and what changes to make starting this week. But before we get into the causes, I need to change the way you think about saliva. Because the moment you understand what it actually does, you will never dismiss a dry mouth again. Saliva is not just water. It is a living, active biological fluid packed with digestive enzymes that begin breaking down your food before it ever reaches your stomach, minerals that protect your tooth enamel around the clock, and antibacterial proteins that fight off infection inside your mouth every single day. When saliva production drops, teeth become more vulnerable to decay, swallowing becomes harder and more painful, and in adults over 75, difficulty swallowing is a direct contributing factor to aspiration pneumonia, one of the leading causes of hospitalization and death in older Americans. And here is what changes specifically after 60. Your salivary glands age along with the rest of your body. Baseline production is already reduced, so when any additional factor cuts into that already reduced output, the impact hits you far harder than it would have at 40. The World Health Organization estimates that xerostomia, the clinical term for dry mouth, affects 20 to 30% of the general population. In adults over 65, that number climbs above 40%. So let's get into the causes, starting with the one that surprises nearly every patient I sit down with. Cause number 1, chronic dehydration, but not the kind you recognize. When most people hear dehydration, they picture dizziness, dark urine, intense thirst. What I'm describing is something far quieter and more dangerous, a mild, persistent dehydration that older adults carry without ever knowing it. Here is why it happens. After 60, the cells in the brain responsible for detecting when your body needs water, the osmoreceptors in the hypothalamus, gradually lose their sensitivity. A person in their 30s starts feeling thirsty after losing roughly 1% of their body's water volume. A person in their 70s can lose 3%, even 4%, without feeling any thirst at all. The result is a silent, chronic dehydration that never announces itself. And waking up with a dry mouth is often one of the only visible signs of that invisible state. A study published in the European Journal of Clinical Nutrition that followed more than 800 older adults found that 65% of them had some degree of chronic dehydration, and the large majority reported no subjective sensation of thirst. I had a patient, I'll call him Frank, 73 years old, retired contractor from Arizona. He came in with severe morning dry mouth and lips so cracked they bled. He told me he drank plenty throughout the day. When I asked him to write down every single thing he drank for a week, The list was coffee, sweet tea, juice, and under 2 cups of plain water. We put together a simple protocol. 1 glass of water at wake-up, 1 before every meal, 1 before bed. In 3 weeks, his morning dry mouth had improved by over 70%. That one change. Nothing else. What to do? Do not wait to feel thirsty. In older adults, thirst is a late signal. By the time you feel it, you are already behind. Set reminders on your phone. Place a visible glass of water in every room where you spend time regularly, and aim for 6 to 8 cups of plain water every day, not counting coffee or juice. Cause number 2, sleep apnea. And this one catches almost everyone off guard when I bring it up. When the airway collapses during sleep and breathing pauses, the body automatically opens the mouth to compensate for the blocked airflow. Spending hours with the mouth open dries out the tongue, the gums, the inner cheeks, and the lips. You wake up feeling like you slept with a fan pointed directly at your face all night. A research study that followed over 1,000 adults with morning dry mouth found something striking. While only 3% of people without nighttime breathing problems reported waking with a dry mouth, among those with severe sleep apnea, that number jumped to more than 31%, 10 times more frequent. And dry mouth was often the only symptom the person noticed, because the apnea itself happens while they are unconscious. After 60, the muscles of the throat naturally lose tone. More than half of older adults have some form of sleep apnea, and the majority have never been tested for it. I have had patients who were completely certain they did not snore, whose sleep studies came back showing more than 25 breathing pauses per hour. What to do? If you wake up dry-mouthed and also feel unrested despite a full night of sleep, wake with a morning headache, or get up repeatedly to use the bathroom, talk to your doctor about a sleep study. Polysomnography is the gold standard for diagnosis. Treatment can be genuinely life-changing, not just for the dry mouth, but for your heart, your memory, and your energy level. Cause number 3, diabetes. And the angle here is critical for anyone over 60. Type 2 diabetes is one of the most underdiagnosed conditions in older adults. Not because physicians skip the tests, but because the classic symptoms present differently in people over 60. Dry mouth is one of the first signs of diabetes, especially when it comes alongside thirst that water doesn't seem to satisfy, frequent nighttime urination, and persistent fatigue that rest doesn't touch. The mechanism is direct. When blood sugar is elevated, the kidneys try to eliminate the excess glucose through urine. To do that, they pull large amounts of water from the body itself. The tissues become dehydrated from the inside out. The salivary glands receive less fluid. The mouth dries up. The CDC estimates that more than 29% of Americans over 65 have diabetes. And the American Diabetes Association reports that nearly 1 in 4 people living with the disease have no idea they have it, because in the early stages, symptoms are subtle enough to be written off as normal aging. Fatigue? Must be age. Dry mouth? Must be the weather. Waking up at night? Everyone does that. Meanwhile, the blood sugar climbs. What to do? If morning dry mouth comes with excessive thirst during the day, nighttime urination, or fatigue that never fully lifts, ask your doctor for a fasting blood glucose test and a hemoglobin A1C. These are routine, widely available blood tests. They can reveal a diabetes that has been progressing quietly for years. Cause number 4 is medications. And this is where I have to be completely honest with you, because this is the area where the healthcare system fails older patients most consistently and most quietly. And it affects millions of people right now. The U.S. Department of Health has documented over 400 medications that list dry mouth as a known side effect. 400. And many of the most commonly prescribed medications in the country are on that list. Blood pressure drugs, especially diuretics, which pull water from the body and reduce saliva output. Antidepressants that act on the nervous system in ways that suppress salivary secretion. Antihistamines for allergies, which block the same receptors that regulate saliva production. Bladder medications, widely used by women over 60. Sleep aids. Anti-anxiety medications. Medications for Parkinson's disease. Each of these individually may cause mild dryness, but when a person is taking 4, 5, 6 of them simultaneously, which is the daily reality for millions of older Americans, the effects compound. This is something I wish more of my colleagues talked about openly. Most doctors simply do not look at the full medication list as a unified system. You go in for your blood pressure, you come out with a prescription, and nobody sits down with all 6 bottles and asks what they are doing to each other. I have been conducting medication reviews for over 2 decades, and I can tell you with confidence, polypharmacy-related dry mouth is massively under-recognized, and in most cases, entirely reversible once someone finally looks at the whole picture at once. I had a patient, 76 years old, retired teacher from Tennessee. She came in with a mouth so dry she could not eat a piece of toast without water nearby. When I counted her medications, 7. A diuretic, a blood pressure pill, an antidepressant, an antihistamine, a sleep aid, a joint pain medication, and a bladder pill. Every single one with the potential to suppress saliva production. Together, they had turned her mouth into a desert. We worked closely with her primary care physician, substituted 2 medications for alternatives with lower impact on salivary output, and adjusted the timing of 2 others. 6 weeks later, she called the office to tell me it was the first time in nearly 2 years she had eaten a full meal and enjoyed every bite. What to do? Gather every single thing you take: prescriptions, vitamins, supplements, over-the-counter medications. Put it all in a bag and bring it to your next appointment. Then ask this exact question. Could any of these be causing my dry mouth? And is there an alternative? That question alone can change your quality of life. Cause number 5. Sjögren's syndrome. And this one is especially important for women. Sjögren's is an autoimmune condition in which the immune system turns against the glands responsible for producing moisture, primarily the salivary glands and the tear glands. The result is a mouth that burns and aches, where even soft foods are difficult to swallow, and eyes that itch, burn, and stay chronically red. About 90% of Sjögren's patients are women, and diagnosis is most common between ages 45 and 65, right in the postmenopausal window, when the immune system is already going through significant changes. The most critical problem with Sjögren's is the delay in getting the right answer. On average, a woman with this condition waits 3 to 5 years between the onset of symptoms and the correct diagnosis. The dry mouth gets blamed on dehydration. The dry eyes get blamed on screen time or fatigue. The joint aches get attributed to arthritis. The disease advances while nobody names it. What to do? If you are a woman with dry mouth that doesn't improve with better hydration, and you also have chronically dry eyes, unexplained fatigue, and joint pain, ask your doctor to run specific autoimmune antibody panels, including anti-SSA and anti-SSB. An early diagnosis leads to an early start on treatment. I have seen patients go from feeling like their own body had become their enemy to feeling fully themselves again. Cause number 6. Chronic kidney disease. And as I've told patients for years, this condition is far more common in older adults than most people ever suspect. When the kidneys lose their capacity to filter waste properly, toxins accumulate in the bloodstream. The body tries to compensate by increasing urinary output, losing water in the process. The salivary glands receive less of it, and many patients with kidney disease describe something very specific alongside the dryness: a metallic or ammonia-like taste in the mouth. That is waste material that the kidneys should have filtered, making it all the way into the saliva instead. If your morning dry mouth comes with swelling in the legs or feet, foamy urine, blood pressure that is difficult to control despite medication, or crushing fatigue, kidney function needs to be evaluated without delay. And here is something the standard medical visit often misses. A creatinine test alone can come back completely normal, even when the kidneys are working at only 50% of their capacity. Ask specifically for your eGFR, estimated glomerular filtration rate. That is the number that reveals the real picture. Now let me give you a clear, practical plan for everything we have covered today. First, observe the pattern for 1 full week. Does the dry mouth happen every single morning? What other symptoms show up with it? Excessive thirst, fatigue, dry eyes, difficulty swallowing, nighttime urination, morning headaches? Write it all down. That written record is your most powerful tool when you walk into a medical appointment. Doctors respond to patterns. Give them one. Second, fix your hydration approach starting today. Don't wait to feel thirsty. 1 glass of water at wake-up, 1 before every meal, 1 before bed. Use phone alarms, a marked water bottle, a glass sitting visibly on the counter. Your goal is 6 to 8 cups of plain water daily. Third, bring your full medication list to your next appointment. Everything in one bag. And ask your doctor to look at all of it together. You are not asking them to change everything. You are asking for a complete review. You deserve that. Fourth, based on your other symptoms, ask for the right tests. Fasting glucose and hemoglobin A1C for diabetes. Creatinine and eGFR for kidney function. Autoimmune antibody panels if you are a woman with dry eyes alongside dry mouth. A sleep study if morning fatigue and headaches come paired with the dryness. And fifth, protect your oral health with more deliberate care starting now. Saliva is your mouth's natural defense system. When it drops, the risk of cavities and gum infections rises significantly. Brush at least twice daily with fluoride toothpaste, floss every evening, and see your dentist at minimum every 6 months. That is not optional when dry mouth is in the picture. Before I let you go, I want to say something I mean fully. The human body is an extraordinary communicator. It does not wait for a crisis to speak. It begins sending signals long before the crisis arrives. A dry mouth every morning is one of those signals. It may be telling you something simple, like drink more water, or it may be telling you something more important, something about your blood sugar, your kidneys, your breathing at night, your immune system, or the stack of medications sitting on your nightstand. The problem is never that the body stops talking. The problem is that nobody taught us how to listen. You listened today. And that is already a meaningful step. If you know someone, a parent, a close friend, a neighbor who jokes that they always wake up with a dry mouth and it's just their age, share this video with them right now. A text, a group chat message, a phone call. The information in this video could be exactly what leads them to find something early, and early always changes the outcome. Subscribe and hit the bell so you don't miss what I'm covering next. Because next time, I'm going to talk about a daily habit that new research shows may be quietly damaging the kidneys of millions of older Americans. And it's something almost every doctor still tells seniors to keep doing. You do not want to miss that one. I'm Dr. Nathan Cole. Take care of the signals your body is sending you. They are trying to help.